Fatty liver disease is the most common liver disease that we see in our liver clinic day in and day out. So what is fatty liver? Fatty liver is a simple problem. There is excess fat in the liver. But the problem is, what does this fat do in the liver and which patient should worry about is excess fat? First of all, we need to know that fatty liver is an extremely common problem. For urban dwellers, which means people who live in cities, have a modern lifestyle, high fatty food, gaining body weight, less exercise, almost 70 to 80% of them will have fatty liver. So who should worry? There are three groups of people where the fatty liver can further progress to more advanced forms of liver disease. And these three types of people are people who are obese, those who are diabetic, and those who drink excessive alcohol. Now let's tease out these three groups of people. What does obesity mean? In the context of fatty liver, obesity does not mean that you are really overweight. Even if you're a bit overweight, your BMI is just about 25, but majority of your weight is concentrated around your belly. That means you have abdominal obesity, or what we call visceral fat, that is enough to cause significant fatty liver disease and future problems. So you must watch your abdominal girth or your belt size. If that is increasing, then your risk of fatty liver disease and associated problems goes on increasing. The second is diabetes, especially people who have got long-standing diabetes more than 5 to 10 years, and those individuals who have uncontrolled diabetes, and individuals who are diabetic as well as obese. This group of people really have problems with advanced forms of fatty liver disease. And third is people who drink excessive alcohol. Now, what is excessive alcohol? We will discuss that in another talk where we'll define the limits of alcohol. But people who drink alcohol, let's say every day, are excessive alcohol, or people who drink more than 4 drinks on the weekend are excessive alcohol. This is a very layman type of definition I'm telling you. The scientific meanings of excessive alcohol are different. Now the problem is, if you are a combination of all three of these, you are a bit overweight, you are diabetic, maybe you are taking medication which is controlling you well, but on top of that you drink alcohol. You may not be drinking every day, but you might be just drinking on the weekends. But all these three factors make you at much higher risk of having a more progressive form of fatty liver disease. So we have to understand it's not one risk factor, it's a combination of risk factors. There are other issues. For example, people in the Middle East and those of Asian origin are more prone to fatty liver disease. There's another disease called insulin resistance. Insulin resistance, there are a lot of people. There are ladies who have got polycystic ovary disease. They have insulin resistant. There are middle-aged men who have got insulin resistance. There is a test we can do for insulin resistance. Whenever you have insulin resistance, again your risk of fatty liver goes up. So when you meet a doctor, like a hepatologist like one of us, we assess all your risk factors. You may have simple fatty liver, but if your number of risk factors goes up, then you may have more advanced forms of fatty liver disease, which needs further evaluation and treatment.